Welcome to this video. In this video I will talk about celiac disease. Okay, so from this picture you can see that it also affects, like tropical sprue, it affects the small bowel. Okay, and it's a gluten sensitive disease. Okay, so you should avoid this pizza or burger if you are suffering from celiac disease. Okay, so let's talk about this disease in detail. So first of all, this is immunologically mediated. Okay, mediated inflammation. Okay, so there occurs inflammation in the bowel. This occurs in genetically susceptible people. So how this occurs is, okay, there is a thing named gluten which is present in wheat, rice, barley, okay, and to laser extent in oats also. So you can remember this by pro. Okay, barley, rice, oats, wheat. So this gluten, when this enters the small intestine, so these are the cells of the small intestines. Okay, this is the villi. So what happens is, imagine that you eat that burger. Now this break down into gluten. Now this gluten will be taken up by the cells. Now this gluten which has been taken by these epithelial cells will be presented to dendritic cells. So this dendritic cells recruits T cells, and now from T cells B cells will be recruited, and this will form antibodies, and these antibodies will affect the villi, because this will lead to inflammation, and this causes destruction of the villi of the intestine. And if there is no villi, okay, a blunting of the villi, then proper absorption of food won't be occur. So proper absorption of the food won't be occur, and because of this leads to malabsorption. So what happens in malabsorption is patient will have abdominal pain, distension, okay, will pass foul, bulky stools, okay. Then patient will also have folate and B12 deficiencies, okay. There can be iron deficiencies as well. Then all the essential vitamins may be affected, protein deficiency. In this way, because of malabsorption, so many deficiencies in the body will occur, which will lead to weak body. Okay, so emaciation of the body, and patient will experience fatigue and will affect his socio-economic life. Okay, so now when this type of patient comes to you, what you need to do is, the gold standard test, okay, the diagnosis, gold standard diagnosis is biopsy. You need to do duodenal or jejunal biopsy, and in the biopsy what you will see is blunting. You will see the blunting of the epithelial cells and lymphocyte, intraepithelial lymphocyte infiltrates. So blunting of the villi and lymphocytes. Now further you need to do antibody test, transglutaminase antibody, or you can also do endomysial antibody, anti-glidin. But this is better to be to do, because this is easily available. This test is easily available and easy to do. Okay, while this is very specific, but this is not done because this is so expensive. and also it is not available at every centers. Okay, so yes, now if you do CBC, you will find microcytic anemia. Okay, you can find splenism. Because of this, you can see target cells on smear, target cells, owl jolly bodies, and spherocytes. This can also be seen. Okay, and calcium decrease. When you do electrolyte studies, you will see calcium, magnesium decrease. Okay, vitamin D decreased, albumin decrease. So this is about serum study. This is peripheral smear. Okay, so this way you can come to diagnosis. Now you should also understand that this is a kind of autoimmune disorder. Okay, so it can be also found with other types of autoimmune disorder. So you should also investigate for type 1 diabetes mellitus, thyrotoxicosis, pernicious anemia, okay, etc. So you should keep this in mind while treating this patient. So how you will manage this patient? The only best treatment that one can give to the patient is gluten-free diet. Okay, this will show miracles. Okay, first biopsy is done by diagnosis, then gluten, and then gluten-free diet. After giving gluten-free diet, second biopsy, and you will see the improvement. Okay, there will be a regeneration of the villi. So this is the treatment to be given, and also we should give minerals, vitamins. Okay, iron, B12, folate. Now what is a prognosis? If patient is like taking gluten-free diet, then prognosis is good. Okay, but there is a risk of T cell lymphoma in GIT. Okay, dermatitis herpetiformis. This is related to celiac disease. Okay, this is a kind of skin disease that will be seen alongside with celiac patients. Because the IgA antibodies that is formed in celiac disease patient, okay, will also, this IgA antibody will affect our skin and it will form ulcerative lesions, vesicular lesions at extensor surface limbs. Okay, so you should also keep this in mind.